I just first I'm glad that we're meeting here in Puerto Rico because you're Puerto Rican, me too, and I think for you and me, the Society of Puerto Rican Radiology obviously means a lot. I just want to tell you congratulations on getting the dedication. They dedicated the convention to you, very well deserved. So were you expecting this?
I would no, thank you for the opportunity to meet today, and also, like you said, I think coming to Puerto Rico is something special. Like, not only I recharge battery, but also um, it's a very warm, welcoming. Getting to know everybody here, and like a lot of people that we know through the chat, getting to know them in person as well. I think that's something that um, a very pleasant surprise. And then, although I knew about the recognition, is something that for the ceremony. I was really overwhelmed by the moment. I really not it's something that really caught me off guard, and I got emotional because it's just something that it means so much to me, but also like possible because a lot of people that open up doors, in you
Yeah.
included, and others. Like I said, I'm humbly accepted, but it's something that I really um dedicate to everybody that was there every step of the way.
Well, it's really, I mean, it's huge because I think of what I remember, you're the youngest person that have ever received this recognition. So congratulations. So um, how do you think, you're a very accomplished radiologist that work in Mass General and in the continental US, and how do you think that accomplished Puerto Ricans like you can contribute to the field of radiology here in Puerto Rico and to the radiologists here, like, because me too, I work in Texas and I guess I'm more involved in some things that people here from Puerto Rico find a little hard. So how do you find the best way to help and contribute to radiology here?
That's a very good question. Because sometimes there's a daily, I don't want to say daily, but like a continuous struggle. Like internally, my heart is always here in Puerto Rico. This is my home. My a lot of family, friends. Every time we meet fellow Puerto Rican is something that really fills my heart. And sometimes that internally I like, well, should I go back or stay where I am? And so it's something that when I'm thinking about what what can I do. For example, we're both Latino, Hispanic physicians. There's a big Latino Hispanic community in the U.S. That we can help, and also like not only are part of it, but also we can help provide better care for them. So that one part that I'm always thinking about contributing, but also, for example, like you are very accomplished in terms of like what you do, open up doors, mentoring people, educating people across. You're an expert in the field. You open up a lot of doors, leadership positions in every academic institution that you work in. That's something that keeps a door open for many others. So you're not only contributing currently to the building that future by by your contribution in clinical work, education, research, and leadership, but also you're keeping the door open for people who come in next. And then that's the way that I feel we can contribute as well with our work in terms of keeping the door open for the next generation, always paying it forward, because whether we like it or not, we have an added responsibility in terms of not only we have to make sure that we're doing a good job now, but also we got to make sure that that door stays open
Yeah,
for the next person to cross it and also take it further.
absolutely, and pave the way for people that are wanted to may not have the resources. So, I mean, your work in health equity is inspiring to me and to many others in the nation. I mean, the ACR has recognized your work. But I think myself and a lot of people would be intrigued in how did you get started in this work, and also if you're a person who's interested in contributing to projects in health equity, how would they get involved in it?
That, so that's a very good question, because sometimes I think about, so to me, I'm always thinking about the first patient, like the really, so first when I was, let me just take a step back. So when I first started as staff attending at the hospital, my first assignment was to cover Nantucket Hospital, which is an island of the Cape, and that was a rural practice. And yeah, just acquired that hospital, so we were integrating, and I was able to see the impact of subspecialty care in a rural setting, and how much radiology can contribute. But that didn't really hit me until like so increasing access is critical for improving the health of a community more than just the individual patient, and really the community. And then when I was in main campus, one day I was talking with a patient. She missed a couple of MRI appointments. I said, I went to talk to the patient to the scanner because I thought that she had new symptoms because this time she made the appointment. And I wanted to provide a little bit more precise interpretation of the study just to see what were new symptoms, any additional information that could help my interpretation. And I was shocked that she said she felt the same, that it was only a routine follow-up, that the reason she missed the other appointment was because she couldn't understand the English reminder. She was Latina, Spanish speaker, so myself as well. So that afternoon, sure, it was late in the day, but that kept me thinking how many more are like this patient that are, something simple that we could do in the
It's like
system.
invisible barriers
Correct.
to
And
us. I mean, this it's a real barrier for them, but for us, it's almost invisible
correct.
because you don't even think about it.
We don't think about it. We always think about like, one size fits all. We want to make sure everything is homogeneous or a structured way, but we have to be our care and really needs to be able to be adapted and stay nimble to ensure that we meet patients where they are and their needs. And so when so then that encounter made me look at things more systematically, and then I started looking at our own data, and sometimes well we need to start looking ourselves in the mirror. So I've been very fortunate to be in a practice that is supportive of interrogating the data, and even if the data shows something that we may not be um something that it may not be optimal, but at least that's the first step
To
to improve it,
identify.
right? You identify what's the gap, where what are we missing, and what can we do better. That's the first step. So I've been very fortunate to have support from leadership in radiology at MGH to say go ahead and do it, and that led to like projects. And then at the beginning it was getting a little bit traction in radiology. It, it took some time to build momentum, and but I'm very grateful for like finding mentors also outside of radiology, outside of the institution as well, that have been incredibly supportive of my career, and like this line of work, and then opening up doors and into what I to this. So sometimes I don't sure you get an academic promotion, or you get the academic glory from the work, but that really not what drives me to do it. It really
Yeah,
what
yeah.
like
You gotta do what you like,
right,
obviously.
you have to do what you're passionate about, and this is like more than your work. It's really like a mission that I feel like I can contribute and at least do something to
So if
benefit.
I'm a resident or a young faculty, whoever, and I'm really interested in this topic, but I would like to contribute in any way, how would I do that? If there's any way through the ACR or anything that you can think that people can get involved if they're lost and they want to feel like, okay, I want to contribute in this, but it just seems very something that I don't really know where to start.
I think that for like in it's so there are not everything has to be like a large research project. It can be as something as simple as like the way that we talk about our patient, not using stigmatizing language, not center or person first language. So not defining patient by their condition, but like talking about, for example, no, we don't talk about cancer patient, we talk about patient with cancer. So slight change in the way that we talk, infuse the empathy in the care that we provide. Also the ACR has one of the partners through the Health Equity Coalition as well, so that you can definitely get involved. And then also, even in the reading room, advocating for patients. When you see patients that require additional imaging, even in the ED, and you're advocating for them to get the best imaging possible, the best protocol, that's part of equity, right? Ensuring that everybody has a fair chance of receiving the best care possible. And so where you do it from the reading room, advocating for the right protocol, how you dictate the case, or like talk about patients, or doing research project, or collaborating in community outreach efforts through your institution, or through the ACR or the Health Equity Coalition. There are a lot of many opportunity and for getting involved. And I know now there's a lot of um, emphasis on climate change as well,
Yeah,
and
that
environmental. So that's something that as well, the climate change. disproportionately impact a community that are more vulnerable. So, there's a nice health equity work, really intersectional. So finding a good, so whether you're interested in quality and safety, climate change, or, you know, education or clinical care, there's always an opportunity to advance the mission to ensure everybody benefits
But
from
I
it.
like your idea. I think a lot of people think, well, I want to get involved, but I need to click on somewhere or be through like a society. But I just really love the idea that no, you can, I mean, there's details you can do in your daily practice to, improve health equity and all these missions that we have. And I guess that's the end point of what you do, that it permeates to every reading room and we're conscious about the things that we do. So I think it's a great point, just to not think it as a broad project,
Hmm.
but just start doing it with yourself and get educated on the things and details that we do, unconscious bias and stuff that we can improve the communication with patients, and patients are obviously feel more comfortable and we can decrease that gap. So, well, anyway, so I just wanted to ask you, I mean, you have 4 kids, a beautiful wife, I mean, she's a friend of mine, and I think this is a question I really want to ask you. How do you balance your family life with work? I mean, just really, I mean, you do so much. I see you, in the social media. I see you in a lot of meetings because a lot, the topic that you work is so important nowadays that we kind of need to work on it. So how do you balance that life?
I I don't know if I can call it a balance. I would say, first, I have to say, I have a very supportive family. I have to say, my wife and my kids are definitely there and they're supportive of this work. But also, I would say, I don't think it's a balance. It's more like juggling
Okay.
of things on a daily basis, and then prioritizing and reprioritizing every day. So, like, basically understanding, um, what's important and what's at hand. So, for example, if my one of my breaks from work or everything that I really enjoy, like watching my kids, either coaching them or watching them play sports. Something that, let's say, I block off 2 hours or whatever, and I'm doing that. I don't think about anything else but watching them and just being a fan. It's like cooking for me. I enjoy grilling, and so, like, I'll do that, and then I can't think of anything else but what I'm grilling, because if not, then I'm gonna mess up what I'm cooking. And
You
it's
pretty much like you block the time and you say, okay, I'm not going to answer any like text messages, and I'm really going to concentrate on my
Well, I don't know
kids.
about that text messaging. I think but, like, for example, I won't do any if I'm watching a baseball game or like softball or soccer with my the twins, then that's the time that I'm doing that. And then a lot of time I either early start to the day or late start, so I can try to be, because I know that the time with them is limited. And then I had a mentor that told me, some time ago, talking about positive cycles, and then, like, and what he meant by that, and he was explaining it to me it was that you gotta find things that feed into it,
Yeah.
into, like, not um because if you deviate too much from, for example, your community outreach. So, for example, for me, the community outreach informed my research, and the research informed the clinical care and anything that my academic work, and that, a continuous process that fits into each part. But if I'm doing something, not that I won't accommodate something outside of that, but um, I gotta find a way to try to incorporate it as much as
Yeah.
possible. If not, then if I deviate too much, then I'm stretched too thin and I can't. And I think that part of, like, so when I think about it, um, it just promoting the work is as equally as important as doing the work, because you want to make sure that the work has visibility, that the work is sustainable, and that's the way
Yeah, of
that
course.
when people learn about the work, then it's important. Then they'll feel like they want to get involved, and they can contribute as well, and then find ways.
Yeah, but it's good to be inclusive. Everybody wants to be heard and seen in the things that we do. And of course, I mean, it's true. I mean, sometimes I think social media is good with this. Sometimes you do a lot of work and nobody sees it. And I mean, obviously you dedicated time and a lot of time is very impactful. But I mean, there's a limited amount of venues that you can show it. So I think it's important to work on that. But I mean, I asked that because I know when you get really busy, especially people of our generation, we kind of need to learn how to stop and say, look,
Hmm.
this is, I need to be having some quality time with my family and all this is besides work because, things can be consuming.
Yeah, absolutely, it's a continuous struggle. Sometimes I'm like, am I? Yeah, so like, sometimes you have like a deadline. For example, if you have a deadline for a grant or you have to submit something, and for example, like RSNA abstract are coming through now this week, and I'm like, okay, so or like the presentation that we're doing now. So, I was finishing that and I'm like, okay, so I had to decide, make a conscious decision about like, okay, so for example, last night I was like working on the presentation, but my dad was in the hospital, so I had to decide, I'm gonna spend the time with my dad because he needs that done. And then when I come here, I'll just get a new coffee.
Yeah,
Coffee
okay.
is my best friend, and then you'll
That's
finish the
right.
presentation, because that's what it takes, and we'll do what it takes. And I think in medicine, similar to what we do with our patients. So, but something that I wanted to also mention is that when you're talking about how to get involved, like I think that it's important just to have the right motivation. And for example, I admire the work that you do a lot, because like not only you deeply care about the next generation, and like even like we were talking yesterday, you talking about how you go um, and learn how to like make the presentation the best possible in multiple, in English and Spanish, making sure that the education is accessible through social media, something that, and the impact of how many people are learning from your expertise and knowledge is unmeasurable, and that's not only now but also in the future as well. So that that's something that I really admire about your work and what you do. And like so when you're thinking about equity and like making sure people have fair access to high quality education, becoming an expert, or like having more knowledge and providing better care, you're definitely at the forefront in that.
Thank you. Yeah, we're also the forefront of the social media. I think I don't know what I'm doing, but for some
No,
reason, I
no, you're doing phenomenal
it
work
gets
like always.
traction. So I wanted to ask you. I know you're a mentor to students, and I've seen you here with some of your mentees, and residents, and now their faculty. I ask this to people who are in education all the time, and it's just a simple question: why do you mentor students and residents? What is your driving force behind it? Because obviously it takes time. Like I myself, I can't mentor. I mean, I have a certain number of people I mentor because if you want to do it right, it takes time. So anything that takes time, so there's no monetary compensation, there has to be a driving force. So what is yours? If you can explain like briefly.
No, for me, it would be like I wouldn't be where I am if I didn't have mentorship guidance along the way. For many people, you included, like a lot of Dr. Colon, Dr. Rodriguez, like a lot of people. Also, my mentor and currently, my chair, Dr. Brink, Dr. Betancourt, were like my mentors as well. And I see that they take time out of their busy schedule. Same thing with Dr. Carlos, Dr. Park, Dr. Irwin. So all of them, they take time, genuinely care about my, not only my academic career, but also for me as a person. And then they take the time to do that, and they don't have to because they're super busy. And so I just feel that the need to pay it forward to the next person as well. So anytime that all these people have opened up, and many more have opened up a lot of doors for me and helped me along the way. So my duty is to, do the same for who's up and coming
Yeah,
as
so
much as
pay it
possible.
back. Yeah.
Yeah,
Well, that's amazing. I think that we need more people, and I involved in mentorship education. And I'm glad that the ACR and all our societies now are trying to create more clinical educational tracks. So the people that want to follow education and mentorship get support because obviously it historically has been overshadowed by
correct.
research and clinical work because it's busy and it's more it's financially makes more sense. But it's important. Like we have to pay it back because otherwise who's going to take care of us
Correct.
when we're old. So all right, so it's just one last question. What's the best advice you can give to a student that is interested in radiology?
I wish.
And the reason I asked is because well, I'll talk about after you finish your questions, but the reason is that obviously you're a role model for a lot of people that are minorities like you, Hispanic or not, and they see you as a role model. And I think that has happened to me before that I've sometimes in a meeting or something, and a student comes and he's like, "I want to be like you." I was like, "You want to be like me?" Don't make any sense, but we don't realize it, but we're some sort of role models to some people who are trying to get to where we are. So what would be your best advice for students that is interested in radiology?
I think that so that that's interesting because you definitely are a role model for me since I was a student. So one of the reasons why I got into it was the pure joy of seeing you go through clinical cases and teaching, taking the time. You didn't have to. You had a big list, but you always got involved in that. To me, always you always been a role model, and I sincerely mean it. You have no idea how much you inspired me and many others. But to me, to the when I tell medical students in terms of like why radiology, because first I wouldn't do any other career than radiology. I get a lot of like the daily satisfaction. It's amazing. The work, sure, we're all busy in healthcare in general, but like we're able to touch so many lives and on a daily basis. Plus, I just tell medical students that also if they're interested in pursuing any additional interest, whether it could be informatics, quality and safety, health equity, education, clinical care, all of that, radiology will provide an avenue to do that. And then you'll find a very welcoming environment in radiology that it will be waiting for them with open arms to not only support their clinical work, but also their lives as individuals.
Well, thank you, Efren, for talking with me today. I'm really excited that you're here. Congratulations on your award. Just please remember always that you are an incredible role model for young people and especially for minorities and underrepresented people that see you as somebody that, in a good way, has achieved a lot of accomplishments that, at the end of the day, affect patient care in a positive way. So, thank you for everything, and I'm sure we'll be seeing you around.
No, no, thank you so much for the opportunity. Really humbled by this, and truly something that the work is like, I'm just thankful for the team and family that everybody been supportive along the way, and hopefully, we'll continue doing that. But I'm really honored to be here and really appreciate the time too.